Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in the video today, I'm going to be discussing how I studied for my end of rotation exams and how I prepared myself for my end of rotation exams. I hope this video is helpful. And before I start this video, I do want to say that this is just based on my experience and my opinion. Other students, other PAs may have different experiences or other opinions, but this is just based on my experience and opinion attending PA school, graduating PA school, taking my exams, passing my exams, etc. So you're about to start your clinical year PA school and you are studying for your end of rotation exams. One thing that I do want to start off by saying is that your end of rotation exams are very different in comparison to your didactic year exams. One of the reasons, and I can say that in my experience, is that I felt like the exams during the didactic year were a lot easier in comparison to your exams during your clinical year, so your EORs. Didactic year was a lot more easier than EORs. During my didactic year, my exams were created by my professors, versus my clinical year, the exams are created by the NCCPA, okay, which is the National Committee of Certified Physician Assistants. They are the individuals who create the PANS exam, which is the exam you have to take before you get certified as a physician assistant. So the questions that you're going to see on your EORs are going to be very similar to the questions you're going to be seeing on your PANS. The questions on your EORs are going to be more higher level questions, right? They are also going to stay away from buzzwords. Also, your PANS is staying away from buzzwords. During my didactic year, we saw a lot of buzzwords on my exams, which made them easier because if you memorize a buzzword, you knew what the answer was. Even if you didn't know what was going on in the vignette, but you saw that buzzword, right? That right lower quadrant, tenderness, that it started in the epigastric region and then it went to the right lower quadrant, right? You're like, appendicitis. But in real life, does appendicitis always present with that right lower quadrant tenderness? No, some patients just present with generalized abdominal tenderness. And so I can see why the NCPA is kind of staying away from those buzzwords. So expect to see not so many buzzwords during your end of rotation exams and then also your PANS exams. Another reason why I feel that didactic year exams were a lot easier in comparison to clinical year is that in didactic year, if your program is like my program, throughout those 12 months, your didactic year is going to be divided into exams depending on what organ system you're studying, right? For example, we had a cardiology block. So our pharmacology exams were all on cardio medications, right? ACE inhibitors, beta blockers, angiotensin receptor blockers, etc. Pathophysiology was all in regards to cardiology. Our clinical medicine class was all in regards to cardiology. So it was just based on whatever system we were learning. You're taking the PANS, you're taking your internal medicine rotation exam, you're going to have a lot of topics. You're going to have topics on cardiology, pulmonology. You're going to have to learn the pathophysiology of cardiology, pulmonology, GI, everything. Pediatrics, infectious diseases, right? Dermatology, cardiology once again, pulmonology. It's all everything mixed because once again, this is preparing you for the PANS because when you're taking the PANS, it's going to be everything. It's going to be psychiatry, it's going to be internal medicine questions, it's going to be pediatrics. I mean, it's going to be all mixed. So your second year is preparing you to take the PANS. So depending on how well you study for your end of rotation exams is really going to help you in regards to passing your PANS exam. So that's why it's really important that when you are studying for your end of rotation exams, you study well. You don't only memorize and dump. And I can say this even from a didactic year. If you were those individuals that just memorized and passed the exam, that's awesome, good for you. But if you didn't actually learn the information or understand what was going on, it's not going to help you out in regards to your EORs and even during clinic, right? When you get asked by a doctor, what's the pathophysiology of this disease? Why are you ordering this test, right? How are you going to treat this? What's the microbiology of this pathogen, etc. So it's really important that you learn your information, you don't only memorize and dump it. So, okay, I've gotten that off my shoulders, so just wanted to say that. I'm a huge, avid person that just really, really wants to emphasize and learning the information, not only memorizing and dumping. It's going to make you a better provider. It's going to help you pass through EORs. You're going to be able to understand the mechanism of actions of certain drugs, right? Why does this disease present this way in this patient? So it's also going to develop those critical thinking skills, which is something that you need as a medical provider. Any individual that wants to go into medicine needs to ensure that they have those critical kind of thinking skills, or critical thinking skills in general. So how did I study for my end of rotation exams. So I know when you are during your clinical rotations, sometimes it's a lot harder to study because you come home from clinic, you're exhausted. If you saw 20 plus patients that day, right, you just don't want to come home and study. In addition to that, if you are in a certain rotation, like my surgery rotation, where you're in surgery all day, you're on your feet all day, you're trying to prevent from passing out, right, from staying on your feet, lack of food, and you still have to get home and study, or sometimes you didn't get to study during the week because you were getting home like at 9, 10, 11 at midnight, right? And then you just haven't had time to study at all during the week. I know it can be a little bit harder, but it's really important that you motivate yourself and that you have a schedule and that you stick to that schedule so you can ensure that you get your studying in. So when I studied for my end of rotation exams, what I did is that the first few weeks, so I would do the first 3 weeks, because my rotations were about 5 weeks. The first 3 weeks, I made sure that I learned the information, whatever was on the blueprint. The NCCPA will give you a blueprint and they will tell you what topics are in the exam. Sometimes they have really broad topics. For example, if you are in your ER rotation, the blueprint says acute abdomen. There's so many things that can fall under acute abdomen, right? Appendicitis, for example, is one that can fall under acute abdomen. A lot of things can fall under acute abdomen. So sometimes they'll be very specific or they'll be very broad like that. And so what I did is that I went through the entire blueprint those 3 weeks, and then those last 2 weeks, I did a lot of practice questions. I did as many practice questions as I could. Why did I do them? Because they really help you out in regards to kind of seeing patterns with the common things that they like to ask, right? And how do you see that question in a different way? So one of the questions bank that I really liked, I used a lot of Wash Review for my EORs. I used a lot of Smarty Pants for my EORs. I did some Exam Master, but definitely the one that I really liked was Wash Review because they just have really good vignettes. They have really good pictures if you're a visual individual. They have really good pictures that explains the information in a succinct way, especially since during your clinical year, sometimes you don't have a lot of time. This is a way that you're able to see the information in a succinct, summarized way. And so those 2 weeks, I did a lot of practice questions and they really helped me out when I took my PANCE because like I said, you're getting your brain accustomed to seeing those questions and seeing them in different ways. What are the common things? What are the patterns that you see when you're taking your questions? First 3 weeks, right? Ensure that you know your information, learn the information, relearn the information, learn things that you didn't know before because I know during my didactic year, there were certain topics that we never learned and they were on the blueprint, your EOR blueprint. And so I was having to learn that information. Or sometimes when I was going through certain Roche review questions or just practice questions, there were certain diseases that I had never heard about in my life. So I had to go back and watch the pathophysiology, the diagnosis, the treatment, etc. And so those first 3 weeks, ensure that you learn the information. Those last 2 weeks, do a lot of practice questions. And then also the practice questions are going to help you see what is your weakness in what topic. So for example, during my ER rotation, cardiology definitely was my weakness at the beginning of my clinical year. So I made sure I did a lot of questions, practice questions in regards to cardiology, okay? And so that way it's gonna help you get better at your weakness and ensure that you do well on your end of rotation exam. Another thing I am a huge fan of is just repetition. So I love flashcards. I use flashcards for my PANCE, and I do have to say that they are the reason why I was able to pass my PANCE and I was able to pass my end of rotation exams, because repetition is a key. Repetition, repetition, repetition. I can't say that enough. So I did a lot of flashcards. On the first day, I would create a deck of flashcards and I would go through them every day. And the ones that I used was osmosis. I'm a huge fan of osmosis. That's just my experience. I know some of other individuals I've spoken to, Anki is one that they use, and the reason why they use Anki is that there's prior students or other individuals who have created certain flashcard decks for your EOR, for your PANCE, so you're able to use those. I also, when I had the time, I would create my own Quizlets, but the majority of time I did use osmosis. And the thing I like about osmosis is that you're able to shuffle whatever you want. So I would shuffle pharmacology, I would shuffle also pathophysiology into it, clinical medicine, like the diagnosis, treatment, because those are the type of questions you're going to see. You're going to see questions on drugs. What's the mechanism of action of this drug? What's the side effect? What's an adverse effect? Who is it contraindicated in? You're going to see questions on pathophysiology, right? What defines an upper GI bleed in comparison to a lower GI bleed? Like, what is the anatomical feature that differentiates them, right? With the ligament of Treitz, for example. And so you're gonna have questions on pathophysiology, diagnosis, and everything. And that's why I really like osmosis, is that what I did is that I would go through osmosis, you have flashcards, and then I would go through the entire blueprint. It would take me about an hour just to make sure I get everything on my deck. And so if it said, for example, appendicitis, I would click on appendicitis. If it said, for example, gastroenteritis, Shigella, Salmonella, mechanism of action of drugs, ACE inhibitors, beta blockers, ARBs, etc. So I put that all on my deck. So I would start that on day 1. And I'll be honest with you guys, sometimes my decks, like for emergency medicine or internal medicine, they were long. So I had like 4,000 flashcards that first day. But I would make sure that I finished all the flashcards, hopefully by the second week, if not by definitely before I take my exam. But usually I would try to finish them by the second week, and I would just do them whenever I had downtime. So during lunch, go through my flashcards, right? If I was doing my surgery rotation and I had a lot of time, sometimes in between surgeries, I was starving because I didn't want to go eat, and then the doctor was like, hey, I'm in a surgery, where are you at? And so during times where I had downtime, I would go and just sit in the waiting room and just go over my flashcards. So any time in between that I had free time, I would go through my flashcards. Any flashcards that I didn't finish, I would go home and finish them before the next day. And so flashcards that you were finished, they get repeated, and you do them the next day over and over again. If there's flashcards that you went through them super fast and you said, I know these really well, it won't repeat them until maybe a week later. If it's a flashcard that you did poorly on, it's like it's red, you got it wrong, it's gonna repeat it within 10 minutes, if not the next day. So I really recommend osmosis. I really like osmosis. You do have to pay for it though. I got 2 years for it, but I feel like it was really beneficial. Also, if you're a visual person, they have a lot of videos. And so I did use their videos for understanding new diseases that I had never heard of if they were in the pants. So I would go through their videos and they really helped me out. And so I hope this video was helpful for you guys. That's just basically how I studied for my end of rotation exam. So once again, 5-week rotations. First 3 weeks, go through the entire blueprint. Last 2 weeks, go through as many questions as I can. Every day throughout the entire rotation, I'm going through flashcards over and over again. Repetition is the key. It's going to be staying fresh in your mind, and it's going to help you pass your pins. Alright guys, I hope this video was helpful. As always, if you have any comments or any feedback or just any questions in general, comment below, and I'll talk to you guys later. Bye.